I've studied different lung diseases in families for a long period of time now, and I think that it's one of the most promising directions to help us understand certain components. So what might you guess would be good reasons to study diseases in families? IPF would be a good marker of that. Say again? For your kids, yeah. So genetics and understanding diseases in families. I have a strong bias to think that we were just talking that most things about us, maybe all things about us, have a genetic basis. So the way you look, kind of everything about the way your body's made and the development is all controlled by DNA and the genetics. Okay. They can hear us in the hospital now, I think. So genetics controls a lot of things about us, even things that you would guess might not be related to genetics. For instance, infections seem to come from the outside, but the way you respond to infections is highly genetically controlled with your immune system and others, or even how you recover from injuries. So even things that you think of about outside of the body that might not have a genetic basis, the response to those. The same with diseases. A lot of the things that you've heard about that from Dr. Noth about that happen in pulmonary fibrosis, whether those are part of the disease itself or the body's response to the disease with the different chemicals that he mentioned, is very difficult to know because, of course, the body responds to all other types of conditions as well. So the reasons that I think study families are most important is really it's the best way to find the origins of disease. Because when we see patients who develop pulmonary fibrosis or really any other lung disease, by the time a patient has symptoms, the disease is pretty far advanced, and so at that time, telling the origin of disease from what's the body's response to the disease may be very difficult or impossible, in my opinion. And of course, the reason to understand the cause of the disease is so that we can develop new approaches to treatment. So Dr. Noth told you, I think it was 12 different treatments don't help IPF, and in fact, we don't know a treatment that helps IPF yet. And perhaps that's because we don't know the cause. At least that's one possibility, I think, and maybe the treatments are not designed at the origin of the disease. Certainly, these are good efforts by very dedicated physicians and scientists, but we yet don't have a known effective treatment, and of course, that's what we all want. So I thought I'd show you one other serious lung disease that I've been especially interested in. John Newman and I began working on this disease in 1980, and a lady who came to Vanderbilt. And that example is pulmonary artery hypertension. You heard about it as a complication of IPF from Dr. Noth, but it also happens in the lung aside from other lung conditions. So pulmonary hypertension may happen, so that's just high blood pressure in the lungs. That happens whenever there's any serious heart or lung disease, or whenever there's blockage of the vessels with blood clots or other reasons, or some rare causes, cirrhosis or other things may cause high blood pressures in the lungs. This is a disease that's absolutely fascinating that was poorly understood. Again, nobody knew the cause. There were no treatments in 1980. Now there are 8 approved treatments, but they're not all that good. We need better treatments even when we found ones that seem to work. But we had a patient whose family had 6 patients in 1980, and several of us have studied this disease for many years, and now for this disease, we basically know the iceberg. So for familial pulmonary hypertension, we know 80% of the families are caused by mutation in one specific gene, bone morphogenic protein receptor 2, and that gene then controls the regulation of growth of the vessels. Basically, the small vessels the size of a hair grow closed and then block blood flow through the lung. So in pulmonary hypertension, we know the iceberg, and we're looking for some other features. In IPF, I would argue we know the tip of the iceberg now in causes of IPF in families, and we expect that during the next several years, this is a wonderful time with the Human Genome Project or the other information about genetics and genomics to be interested in familial diseases. And We suspect that much more information will become available so that we'll know the iceberg in familial pulmonary fibrosis rather than just the tip of the iceberg. So in these families, 110 families we know at Vanderbilt who've had 2 or more patients with pulmonary hypertension, there are literally, I think it's 4,000 individuals in the bloodline who might have that mutation or at risk for pulmonary hypertension. Here's one family from Tennessee. I believe it's the largest anywhere, but it's the family we began to work on originally. I don't know if you can see the dot. So this is the lady that we saw originally in 1980. Turns out there were 6 cases in her family. Now there are 31 individuals in this extended pedigree that have had pulmonary hypertension in their family. So we know exactly the cause. Every solid dot on there is an individual with pulmonary hypertension. Circles are women, the squares are men. And this is a fascinating disease because you can have this genetic mutation and never develop the disease. So if you have this genetic mutation, there's still only a 1 in 5 chance that you'll develop the disease. The risk to children of these individuals who transmitted the disease is that they may eventually develop the disease. So this is just an example to show you that great progress has been made in other diseases, and I'm absolutely confident that similar progress can be made for IPF and other lung diseases that may lead us to understanding about central basic mechanisms that then I hope will lead to therapies that are truly effective and change the course of disease. So we talked a lot this morning about excellent talks about what IPF is and what can be done or can't be done for IPF currently.